most important thing is to realize women have a urinary tract. Women many times need to see urologists. And in fact, many of the conditions we see as urologists actually are more prevalent in women than they are in men.
Hey Kathleen. How are you doing?
The good news is I had a chance to review some of the tests that we did last time you were here. Women actually constitute over half of our patients in a lot of different conditions that we look at. Because the urinary tract seems to be a source of affliction for women in so many different ways, shapes, and forms. There are a number of conditions that we see as urologists that absolutely affect African American women. Well, one of the screening tests that we actually do for kidney cancer is blood in the urine. So the biggest encouragement I have to women, especially African American women who can get kidney cancer with a significant prevalence, is that if you ever have blood in the urine, that's not a normal thing. And don't just kind of chalk it up to, oh, it's a urinary tract infection. If you ever have blood in the urine, you absolutely should see your doctor, your primary care doctor. And if you don't have one, then see a urologist, because bladder cancer and kidney cancer very commonly present with blood in the urine. Urinary tract infections happen all the time. There's two groups of people that I see. Women who are first becoming sexually active and maybe going off to college, and they tend to get quote unquote kind of like sexually related urinary tract infections, very much akin to the honeymoon cystitis. The other group of women are women who are postmenopausal, and it's probably because of complex interaction with decreased estrogen levels, which makes it more likely that they're going to get infections because they can't fight off urinary tract infections as well. So some of our elderly patients have urinary tract infections as well. Stress incontinence is incredibly common. Now, stress incontinence in general is a type of involuntary leakage of urine, essentially when women cough, sneeze, or strain down and do exercise. In our community, and we just have to be real, is if you're overweight, stress incontinence is more prevalent. Now, many times stress incontinence is also associated with pelvic organ prolapse, which is like when the bladder falls into the vagina or the rectum bulges into the vagina, or even true vaginal hernias. Stress incontinence is associated with those conditions, and we treat both at the same time. The first thing we like to do is just do behavioral management for women that have mild stress incontinence, really teach them about pelvic floor exercises, such as Kegel exercises, teaching them about maybe fluid restrictions, teaching them about just how to have good core exercises to strengthen muscles that may be involved in preventing against or at least treating minor stress incontinence. And we can actually show you how to do the exercises, and you can do them throughout the day when you're kind of driving for your commute, or if you're kind of sitting up at night reading the paper or a magazine or watching TV. For women that that's not effective, then there are actually some minor surgical procedures that we're talking about can be done in about 15 minutes, and you're in and out of the hospital within a couple of hours. If I could get my patients, men, women, and children, first and foremost to just drink more fluids and to empty their bladder regularly, that will help against urinary tract infections. It helps maintain good kidney health. And if you have any issues with urination, any issues with blood in the urine, any issues with pain over the area of the kidneys, it's always reasonable to see a urologist.